to specifically deal with the various poisons or toxins as well. Alright, so now let's discuss the paracetamol toxicity. Now, paracetamol is a brand name. Let's get to the actual name. Acetaminophen. That's the generic name for paracetamol, acetaminophen. So we are dealing with the common name now. That's the paracetamol we all know, we understand. And it can be toxic in so many ways. It can be toxic in so many ways. When you go to pharmacy, you go to a hospital, you go to, I mean, it's one of the most abused drugs or medications worldwide. Paracetamol is one of the most, if not the most, but if not the most, one of the most abused drugs in the world, right? And to a point now, one of the common causes of hepatitis is viral hepatitis, right? Hep B, Hep C, and all these things. But now, when you go to certain countries, especially in the US, the statistics are that um, concerning liver failure, which the commonest cause was viral hepatitis. Now, paracetamol abuse or acetaminophen abuse is even replacing viral hepatitis. You understand? As a cause of liver failure. So it's when we say it's common, it's very common. So the use. There are a lot of questions on it. But that's why we are here today, and then that's why O.M.A Medical Studio is here to kind of digest with you the kind of thing that goes into it, and then what's the amount that should be taken, the amount that should be taken per day, and then even the amount that should be taken per week. You understand? Now let's get into the details of it. Like I said, I'm not going to bother anyone with so much chemistries and then physiologies and all of that. Just that the basics and the concepts would have to be understood. And when you understand that, you are good to go. So first of all, paracetamol is the same as acetaminophen. And then it comes in, a common dose of 500 milligram per tablet. You understand? 500 milligram per tablet. So commonly, we prescribe is for adults, we prescribe as what? 1 gram TDS. That's a 2 grams. That's two tablets 3 times a day. You take 2 tablets 3 times a day. It means that you are taking 2 tabs every 8 hours. You are taking 2 tablets of the 500 milligram every 8 hours. So the day is divided into 3, 8 hours, 8 hours, 8 hours. So every 8 hours you are supposed to take 2 tablets, which each of them is 500. So you are getting what? 1000 milligram, which is what? Equal to 1 gram. Now, in the syrups, that's the containers for the kids. I'm not going to talk about the injection because you hardly can get injectable PMO in the house to be injecting yourself and all this stuff. You understand? The syrup, whereby we leave them in our homes instead of keeping them out of reach of kids. Kids are exposed to them and all of that. Sometimes we even take it, we give it to these same kids when we send them to hospital. Then they take up to the 5 days dose. Sometimes they don't even take up to that, then the remaining one is still there. Accidentally, this kid can just pick it up and then take. The syrup ones usually comes in different strengths, different doses. Now I have the full bottle equaling like 60 ml, and then you can have another one 100 ml. You understand? Now these doses, or that's the vial, that's the whole bottle, 60 ml of what? The PMO in it, and then another one you have 100 ml of the PMO in it, in the whole bottle. Now most at times you have 5 mils of the 60 ml or the 100 ml equal to 125 milligram. 5 ml of the whole 60 ml bottle equals 125 milligram. If 5 ml of the 60 ml equals 125 milligram, how much milligram will be equal to the 60 ml? That's about 1500 milligram. That's about 1500 milligram. is equal. So in the whole bottle, we have about 1,500 milligrams. That's what 1.5 grams in the whole 60 ml bottle. Now let's get to where we have 125. What sometimes we can have 100 mils, 100 mils, whole bottle, 100 mils, and the dose strength will come in as 5 mil equals 120 milligram. 5 mils equals 120 milligram. And if it's 100 mil and 5 mils of the 100 mils equals 120 milligram, then you are going to have about 2.4 grams. That's 2,400 milligram in one bottle of what, in 100 mil bottle of what, paracetamol. And then sometimes too, we can have um, 5 mils equals 5 mils equaling um, that is 2 point, is it 250 milligram? Yes, 5 mils being what, 250 milligram, just 5 mil being 250 milligram in a 100 mil of what, in a 100 mil bottle of what, paracetamol. If that's the case, then you are going to have about what, 5,000 milligram in that 100 mil, because how do you call it? Because 250 milligram of it is equal to what? 5 mil, and that 5 mil bottle is out of what? The whole what, 100 mil bottle of paracetamol. So now we know the dose strength accounting. It's like I said, you have 60 mils equating to what? 1.5 grams. That's 1,500. You can have another 100 mil equating what? About 2.4 grams. That's 2,400 grams. The whole bottle. You understand? That's the strength for the whole bottle. Now we have dose per weight. When it comes to medications, when it comes to administering medications, most at times we do it by the weight of the particular person or the patient or the client, by the weight. And mind you, in adults, paracetamol, in adults mostly, we it's all part of it. We do the dose per weight, but then in adults, and depending on the severity of the condition, you just don't want to go above the daily maximum dose. That's the amount of dose that is supposed to be consumed or administered in 24 hours. The body can't take up to a certain amount within 24 hours because it can't clear it. You understand? So you need to be very careful when you are taking them. So in adults like this, paracetamol, we don't want to exceed 4 grams per day. 4 grams per day. So, commonly it is what, 1 gram 3 times per day. That is how, getting up to what, 3 grams in a day. That's in a space of 24 hours. Hardly do you see people doing 4 grams per day. You understand? And in kids, so we have that, you understand? But then there's something we call therapeutic index with medications or every type of medication. There is something we call therapeutic index. That's the ratio of the dose that is going to cause harm to your body to the ratio of the dose that is going to really cause the effect we need the drug to cause. That's the therapeutic effect we need the drug to what, to cause. If that ratio is high, then it means that, I mean, like I said, I don't want to bother you guys with the chemistries, but then I'm saying that there is something we call therapeutic index. That's a part of the drug or the ratio of the drug that is going to cause the adverse effect to the ratio of the drug that's going to cause the therapeutic effect we need. If you have a high therapeutic index, it means it will take a high dose of that particular drug to be poisonous to your body. And paracetamol happens to be one of them. It takes a very high dose of paracetamol to cause adverse effect in your body. So it's not, in as much as the abuse and then the toxicity is common, it's not easy to experience, to abuse, to get to the toxic levels of what, paracetamol. So most of the time it's very, very, very intentional. It's very, very like self-induced when it comes to paracetamol toxicity. People intentionally take them because under normal circumstances, considering the amount of paracetamol tablets in a day that can cause harm to your body, as a normal person, I don't think you take up to that level. You understand? we are talking about a dose of about 7.5 grams to 10 grams, which is very toxic to the body when it comes to paracetamol. That's in adults. In kids, we are talking about 150 milligram per kg. So that's per kg body weight. That's the kilogram per body weight. You understand? So 150 milligram times the weight of the person. When that's in kids, when the person abuses it from there. So let's talk about the adult first. In adults like this, you can have like, let's say, it means that if 500 milligram, one tablet of the paracetamol is equal to 500 milligram, then one strip, which is containing 10 tablets, is going to be equal to how many what? How many grams? You understand? So it means that we have 1 gram is on it 10. So that's what? About 5 what? 5 grams. So it means you have to consume beyond that 5 grams within 24 hours. You have to consume, or at once, you have to consume more than that. And I don't think a normal person who has a sound mind would even do that. Just as a single dose, just swallow all of this. And even you have to even go beyond that, you understand? 7.5. So it takes more when you take more than half of the strip. So you're taking the whole strip, one strip, and you're going to take half of another strip. That is, then it becomes what? A toxic dose. And within a space of 12, 24 hours, you can have a lot of damages. You understand? So when it comes to paracetamol, the toxic effect is very, very, very dangerous. Because at the end of the day, these drugs we are taking is going to be metabolized by our liver. And when we talk of metabolism, the drug one, when you take the drug in, it needs to be metabolized before it can be excreted. So your liver is going to be responsible for the metabolism of the paracetamol, and your kidneys are responsible for excreting them. But then before all of these things, before excretion can occur, metabolism has to occur. The liver undergoes what? Metabolism of the drug. If the toxic, if the drug becomes toxic in the body, the liver will be affected and the liver will not be able to metabolize the rest of the paracetamol for it to go to be excreted. There's so much chemistry into this. You take P more, it has to be metabolized. Certain portion of it is toxic to the body. Another thing in the body will have to cover the particular thing that is toxic to the body and convert it to something that cannot affect the body so that the kidney can excrete it. But the moment you take in more than the body or more than the liver can work on, the rest of it becomes toxic to the body. And at the end of the day, it affects the same liver that is helping to metabolize the drugs you've taken in. And what happens? It builds up and it starts to affect the same liver over and over and over again. So this is very dangerous. And so in adults, you need not to consume up to 7.5 and beyond as a single dose. I mean, in a day, you are going to have toxic effects. Now in kids, they are saying that not more than what 150 150 milligram per kilogram body weight. Beyond that, 150 milligram per kilogram body weight and beyond, and also what be harmful to the kids. So let's say, as I was saying, a kid who is an estimated weight of about, let's say, 5-year-old kid with an estimated weight of about, let's say, 9 times 2, let's say about 16, 18, 20 kg, consuming a whole 100 ml bottle of what? Paracetamol. That's like 5 ml equals 125 milligrams. We are talking about what? Equals 120, 5 ml equals 120 milligrams. We are talking about 2.4 grams at once, which will be very, very, very well. I mean, it's even close to toxicity, you understand? And it's very dangerous for the kids. And you know, for the kids, their system is not as matured as adults. When these things happen, it's very difficult to deal with them. I mean, people might be giving red oil and all of that just to kind of suppress, I don't know whether the absorption or something. Yes, it all plays a role in that. You understand? But then let's know that the daily maximum dose you can consume P more. At a daily maximum dose you don't need to exceed 4 grams per 4 grams per day. And then the toxic dose of paracetamol is what? 7, that's in adult it is 7.5 to what, 10 grams per single dose. You don't have to exceed that. You don't have to, when you take up to that, you are putting yourself in trouble. All right. Now in kids, we don't want to get to the toxic dose. That is what, 150 milligram per kilogram body weight. So if the child consumes one bottle, it needs to be alarming because the bottle can be containing, the whole bottle can be 1500 milligrams, that's 1.5 grams, which might not be very scary in such situations, especially if the weight of the child is high. Then again, we have another bottle that is containing about 2.4 grams, that's 2400 grams. That might be dangerous. Then we have another bottle that's containing beyond what, 3 grams or 4 grams, which is very, very dangerous. So if a child takes in anything like that, I mean, when they take it, they just keep it going, you understand? They don't even want to take it off. All these things can be prevented by what? Keeping the medication out of reach of children. You don't have to put it at a place they can easily get access to. You understand? So some of these things can be preventable, yeah, or can be prevented from happening. And that's the most accurate kind of management when it comes to these things. Prevention is the most accurate. Because if the person gets into toxicity, now it is 50-50. Some of these antidotes are not even readily available. You understand? Some of these antidotes are not even readily available. So with our next episode, we are basically going to talk about the management and then what we have to do when situations like that do happen. Like I said, I don't want to bore you with these kind of things. So the chemistries are being too much. So our next episode, fast is going to be a short episode. We are going to talk about how to manage that. The first things to do, and then some of the things, especially with the red oil, the specific things the red oil does and all of that, so that we will know whether sometimes even when to give or not to, when not to give. And even it's going to help some of us, the clinicians, to even understand why certain things are done and why certain things are ignored when the patient or the client or the victim finally gets to the hospital. We are going to deal with all of that. Okay, like I, this is O.M.A Medical Studio once again. Subscribe to the channel, try to share the link, make sure everyone gets access to this, understand this particular thing. And at the end of the day, we are all going to keep on learning. Thank you.